Hello everyone, welcome to Homeovision. Myself Dr. Naveen, practicing homeopathy in Bangalore. Today we will discuss one more important homeopathic remedy, Kali carb. In this remedy, we will discuss the introduction, guiding symptoms, mind symptoms, particulars, modalities, relationships, and some of the points which are helpful for AIPGET and next exams. Coming to introduction, the remedy was proved by our master Hahnemann. The chemical name potassium carbonate or carbonate of potassium. The thermal is chili, miasm, antisoric remedy, diathesis, tubercular diathesis. Coming to guiding symptom, there will be stitching type of pain which is very characteristic of this remedy. Stitching pain, darting means sudden sharp pain which is worse during rest and lying on the affected side. Cannot bear to be touched, starts when touched ever so lightly, especially on the feet. This point asked in 2018 AIPGET. Sweat, backache and weakness. These are the three important points in Kali carb. Early morning aggravation is very characteristic. Person suffering from ulceration of the lungs can scarcely get well without this antisoric. This statement given by Master Hahnemann. Next, coming to mind symptoms. There is a great aversion to being alone. The other remedies are arsenicum, bismuth and lycopodium. Despondent, which means low spirit, alternating moods and very irritable, full of fear and imagination will be present. Next, coming to particulars. In head, headache from riding in cold wind or riding carriage. Headache comes on with yawning. Vertigo on turning. There will be great dryness of hairs and falls out. Next, coming to eyes. There is a bag-like swelling between the upper eyelids and eyebrows. Lids stick together in morning. Weak sight from excessive sexual indulgence. On shutting eyes, painful sensation of light penetrating the brain. Next, coming to nose. Nose bleed when washing the face in the morning. The other remedies are ammonium carb and arnica. Nose stuffs up in warm room. Thick yellow discharge will be present. Postnasal dripping present. The other remedy is pygelia. There is a ulcerated nostrils. Next, coming to mouth. Toothache only when eating, throbbing, which is aggravated when touched by anything warm or cold. Tongue is whitish. Much saliva constantly in the mouth. There is a apathy will be present. Next, coming to throat. Sticking pain in the pharynx as of a fishbone present. The other remedies are heparin and nitric acid. Swallowing difficulty, food goes esophagus slowly. Mucus accumulation in the morning. Next, coming to GI symptom and abdomen. Stomach, which is very sensitive, distended, feels as if it would burst. Excessive flatulence will be present. Everything she eats or drinks appear to be converted into gas. The other remedy is iodine. Feeling of lump in the pit of the stomach. Constant feeling as if stomach were full of water. Gastric disorder from ice water. Stitches in the region of liver. Old chronic liver troubles with soreness. Constipation, stool large, difficult with stitching, colic pains an hour or two before. Next, coming to female reproductive system. Menses early, profuse or too late, pale and scanty with soreness about genitals. Pains from back pressed down through gluteal muscles with cutting in the abdomen. There is a delayed menses in young girls with chest symptoms or ascites. Complaints after parturition. Labor pains insufficient. Violent backache will be present once the back to be pressed. Feels badly. Week before menstruation. Backache before and during menses. Next, coming to respiratory system. Cough, which is dry, paroxysmal, and loosens viscid mucus or pus, which must be swallowed. The complaint aggravated at 3 am. Spasmodic with gagging or vomiting of ingesta, hard, white or smoky masses fly from throat when coughing. Asthma, which is relieved when sitting up or bending forward or by rocking, moving into to and fro movement. The complaint asthma works from 2 to 4 am. Next coming to back. Lumbago with sudden sharp pains extending up and down back and to the thighs. Stiffness and paralytic feeling in the back. Burning in the spine will be present. Severe backache during pregnancy and after miscarriage. Next coming to modalities. The complaints aggravated after caution in cold weather from soup and coffee in morning about 3 am, lying on the left side and painful side. The complaint ameliorated in warm weather during day and while moving about. Next coming to relationship of the remedy. Kali carb is complementary to carbovage. Kali carb follows Naxomica often in stomach and bladder troubles. Follows well after Kali sulp, phosphorus stannum in loose rattling cough. Will bring on menses when natramur though apparently indicated fails. These are the points which are helpful for AIPGT exam. There are two statements which are quoted by Hahnemann. Person suffering from ulceration of the lungs can scarcely get well without this antisoric. Will bring on menses when natramur though apparently indicated fails. These two statements are given by Hahnemann. There is another statement which is given by T.F. Allen. Never use any salts of potash where there is a fever. This is the clinical point which can be helpful for clinical practice. We should not prescribe Kali carb in the time of fever. Salt of tartar, which is also known as Kali carb. There are also time modalities which are very helpful for AIPGT exam. Asthma 2 to 4 am aggravation, cough 3 am aggravation, sleep disturbance at 2 am. These time modalities can also be asked in exam. So this is the remedy Kali carb. Follow us on Instagram, like and subscribe for future reference. Thank you.